Okay, we'll get started. Good morning, everyone. Before we call roll, I believe Representative Kitchens, you have the privilege of some pages that are here in town.
Yes, I'd like to introduce a couple of my pages. If they'll stand up, they're on the front row over here. But I've got Aubrey Gullidge, and Aubrey's from Gulf Shores, goes to South Baldwin Christian Academy. And then with her is Iris Ann Isbell, Representative Isbell's daughter. So they've been running around having fun, and she's from Gadsden.
All right, welcome. Representative Warren, I believe you have a couple as well. If you will, bring your microphone down.
Thank you. We're delighted to have with us this morning William Cuthbert and Kennedy Cuthbert. They're with Representative Tashana Morris. Thank you.
All right, Ms. Clerk, if you will, call roll.
Mr. Lee?
Here.
Mr. Oliver? Here. Ms. Hall? Here. Mr. Lovern? Here. Mr. Sorrells? Mr. Gray? Mr. Lipscomb? Mr. Kitchens? Here. Mr. Marcus? Here. Mr. Mooney? Ms. Meadows? Here. Mr. Stadhagen? Here. Mr. Rafferty? Here. Mr. Sells? Here. Ms. Warren? Here. You got a quorum.
Okay, thank you. All right, a little bit of house cleaning while I have all of you here. 9:30 tomorrow, we will be meeting in room 617 tomorrow at 9:30. That will be dealing with the telehealth bill. This bill is coming from the Senate. If you'll remember, you received a substitute that I told you we were working on. It's identical to that substitute you received, I guess, Friday or Monday of this week sometime. So you, as well as every member in the body, has had it for approximately 5-6 days. So that'll be tomorrow at 9:30. We will also be having a public hearing next week here at our normal time at 10:30, and I'll talk about that after the meeting. Just do not let me forget that, please. All right, we're going to start with Representative Meadows' bill. We're going to change the schedule up. She has a bill in another committee. This is HB 401.
Thank you, Mr. Chairman. I appreciate the opportunity. We do have a substitute for HB 401, and I want to briefly explain what the changes are, and then see if the committee is willing to adopt the sub as what we will be working off of, if that's okay.
I don't think we're going to do that today.
Okay.
No vote today.
No vote. But
No
can
vote. No adjusting or anything. But
Can we talk about the sub?
Absolutely. That's if that's your end goal there. That's what you need to be talking about.
Okay. So what the substitute does is really somewhat technical, but it actually changes the time frame from 9 months to 10 months in the bill, and then from 18 months to 20 months for the certain things that have to be accomplished. There's deadlines. And so that extends the deadline by 1 month instead of 9 months to 10 months, and by 2 months at the end for the whole program to be put in place. The reason for that is really simply to get into the next fiscal year for the Department of Public Health to make sure that we have time to fully fund what their needs are. So that's one change. The other significant changes the word agency to organization throughout the bill, which is why they suggested we do a substitute, because the word agency was in it about 14 times. So if you've read the bill, if you remember what we've talked about a couple of weeks ago when this was in committee, the department hires an agency, and we've changed it to an organization. So the department hires an organization that will run the program, that handles all the work behind the program. And that's intended to be some type of a nonprofit or non-governmental organization that would then do the work. Those are the two main changes. I actually went back and forth on this 6 times, and when I finally got the last one from LSA, they said, "This is your 6th version." I'm like, wonder if that's supposed to tell me it's time to stop. Anyway, I'm happy to answer questions, but we do have a public hearing, so I'd like to let those people speak, whoever's signed up.
Okay, we'll start that at this time. This is for HB 401. We have 3 in support, and let's do 3 minutes. And if you've been in here before, whether this one has none in opposition, but the next one does, you'll have 3 minutes. 3 minutes, whether you're in the middle of a sentence or not, for or against. That's it. That's the best way I can be as fair as I can. So, Michael Ann will start the clock once you start. So to begin with, it'd be Savannah Dietrich.
Thank you, Mr. Chair. Good morning, members of the Health Committee, and thank you for the opportunity to address you today. My name is Savannah Deretich, and I'm the Public Relations and Policy Coordinator with Students for Life Action. I'm here today representing dozens of Students for Life groups here in Alabama and over 1,225 groups across the country to express support for Bill HB 401, the Every Mother Matters Act. The pro-abortion Guttmer Institute reports that women undergo abortions because, quote, having a baby would dramatically interfere with their education, work, or ability to care for their dependents, or they could not afford a baby at the time. In addition, qualitative data from in-depth interviews portrayed women who had had an abortion as typically feeling that they had no other choice, given their limited resources and existing responsibilities to others, end quote. Note to the phrase, no other choice. It is telling that the research arm of the abortion industry acknowledges the fact that its clients felt they had no other choice but to kill their children, despite the plethora of pregnancy resource help organizations, government assistance programs, and other community safety nets standing in the gap for them. I personally know multiple women who have had unplanned pregnancies in college, and it was not pro-abortion people who helped them. It was the life-affirming pregnancy centers and other local churches. They received many free medical services at the pregnancy center, and I speak on behalf of my fellow women who chose life in challenging circumstances because women can succeed when her community gathers together to support the mother and save the child. That is why I support Emma. Organizations and agencies equipped to assist women and children are numerous, but too many women are unaware of them. This lack of awareness was reaffirmed by new polling commissioned by Students for Life of America, which found that although millennial and Gen Z voters support laws funding and candidates aimed at supporting struggling moms and families, the same voters were not aware of the pregnancy help resources currently available to pregnant mothers and students. Emma provides the opportunity to tear down the information barrier standing between the pregnant women and embracing the life of her child. There is no downside to ensuring that pregnant women have access to all the information relevant to their circumstances before she makes the irreversible and often unwanted decision of abortion. Emma will help to reduce the number of children who die of abortion violence, and empower women and families with the resources they need to survive and thrive through pregnancy and beyond. Thank you.
Thank you. Thank you. Next, Miss Sonia Martin.
Thank you, Mr. Chairman. My name is worthless. At least that's what I was told. Having been raised in abject poverty with no indoor plumbing or electricity, abandoned by my mother, and subject to daily abuse encounters at the hands of my stepfather, I skipped the 6th grade, graduated from high school at 16, and went on to college. And like so many other young girls who grow up without a healthy father figure by 17, I was, not at all surprisingly, pregnant. By God's grace, I chose life for that baby. And that sweet 6-pound, 8-ounce baby boy is now 25 years old, a college graduate, married, and on staff at AUM. Against all odds, all those years ago, I became the first college graduate ever in my family. I'm now a licensed clinical social worker, a trauma therapist, a mother of 7 sons, 3 of which were adopted that have special needs. I'm a foster parent, and I serve as the Director of Engagement for Lifeline Children's Services. Lifeline is a ministry that seeks to equip vulnerable families and serve and love them well. We do that in many ways through various ministry arms with a heavy emphasis on family preservation initiatives. But Lifeline is also the largest evangelical Christian adoption agency in the nation. We have many more families willing to step up and step into adoption than we have children available, which on its face sounds like a rather positive thing. But the reality is that instead of these precious mamas placing these children in the arms of loving homes, these sweet babies who hold so much value and worth are dying by the thousands before they even had a chance at life. There is a great imbalance that is occurring when we consider that these women are so tragically misinformed about what happens to the baby, but certainly also about what happens to them post abortion. They are essentially existing in an information vacuum wherein they have tragically little knowledge or information about their options. When women are experiencing unexpected pregnancies, they can and often do react out of fear. And if we know anything, it's that we know that a brain under duress simply does not make good decisions. Knowledge is power. Information is power. But allowing young lady after young lady to make a significant life-lasting decision based on inaccuracy and a limited myopic understanding of what her choices really are is about the least pro-woman thing that we can do. Equipping these women with options is pro-woman. Information dissemination is pro-woman. Let us be a people who... Thank you, Mr. Chairman.
No, thank you. Thank you. Colin LaCroix.
Thank you, Mr. Chairman, members of the committee. Every Mother Matters Act is about an opportunity to rescue 2,000 plus babies every year going forward. Next year in Alabama, there are going to be about 7,000 abortions. For most of those women, they are seeking an abortion because they have no hope. They don't know about the resources and support this community already offers. Often, when they have an opportunity to learn about those resources and support, they make a different choice. Emma is making sure every mom in the state of Alabama who is considering an abortion has an opportunity to learn about those resources. Very simply, there's a diagram in your information. There's a requirement to make a call to a 1-800 number that provides information about the services and support that's available. The mother is given then the opportunity to speak to a nurse about her pregnancy decision and about resources available to support her in her pregnancy. She's also got the opportunity to talk to a social worker about her various social needs and about the various nonprofits and programs that are available to her in the state. Based on the results of a program that my organization runs in various states around the country, we would expect of those 7,000 babies, those 7,000 mothers who seek an abortion next year in Alabama, 2,000 to 2,500 of them will make a decision to keep their child and bring that child into the world, whether that be for parenting or adoption. But 2,000 is a statistic. These are babies. These are individuals. They have different hair and different eyes and different faces. They have different personalities, and they have a future. Each one of them has the potential for a future. That future depends on whether their mother has an opportunity to speak to a qualified professional about her decision for her pregnancy. And whether she has that opportunity depends on whether the Alabama legislature passes the Every Mother Matters Act this year. Appreciate your time, and welcome to answer any questions about the bill as well.
Thank you.
I wanted to say one other comment. 2019, we had 6,007 abortions in Alabama. That's in our federal state records. 2020, we had roughly 5,700 and something. This past year, it was 7,000. So we're going back in the wrong direction, in my opinion. And like they've said, those babies are human beings who could become an AUM professor. Pretty impressive. So I would appreciate the consideration of the committee and the chairman to move forward with this bill at the appropriate time. If that's not today, that's fine. Maybe it could be tomorrow or certainly next week. But lives are at stake, and we need to make this happen. I'm happy to answer questions. Happy to answer questions right now, throughout the day,
Does
right at the baseball game.
does anyone in the committee have any questions or comments before I have a few comments myself, but I'd like to wait. Yes, sir. Representative Mooney.
In reading the bill, obviously this is setting up a type of alternative to receiving a sheet of paper about, I guess you would say, those options or services that might be available. I think I remember a number of weeks ago somebody saying that couldn't even find that paper in the State Department of
That was probably
Public
me
Health.
because I looked for it, and thankfully Carolyn Miss Burns sent me the
Okay.
link to the.
So
So
this would provide an alternative for that in personal interaction as far as counseling.
correct.
And what is the mechanism? Explain the mechanism of how that counseling process would occur to understand how that's going to happen
So the
when someone
mom,
is going to an agency that is offering an abortion and then this counseling is going to occur.
right, the mom goes to the clinic suspecting or knowing that she's pregnant. The clinic says, this is whatever they normally say, and then at the end they say, before you come back to schedule, before you schedule your appointment or before you have your appointment, here's a phone number that we need you to call. It's an 800 number that's staffed with trained professionals that can walk them through a decision-making process. It's an 800 phone call. It's non-identified information. And that's what one of these diagrams, the one with the triangle, circle, and square, kind of shows you. The clinic pulls an 800 number and gives you an 800 number with a number attached for the mother. The mother calls the phone number. She says, "I'm number 32." What's your number? Um, and then they talk to her. If she's completely uninterested and there's, no reason for her to change her mind, then she hangs up and nothing else happens except for the person on the other end puts that number 32 into the state database, and then the abortion clinic can call before she has her appointment and says, okay, number 32 made the phone call. If number 32 wants more information, then the person on the other end of the phone says, I can tell that you were, really needing some more information. Can I connect you right here on the phone with this organization that can answer those questions? Or they say, can I make an appointment with you to go to this organization, down the street from your house or 15-minute drive? Can I get you a cab to get there or an Uber? Today's world. So that's kind of how it starts. And then there's opportunity for follow up. And really that's the process.
Thank you.
Right now,
It provides a personal interaction, is what I was
Right,
wondering.
and,
It
I
seemed to
mean,
be important in that concept.
the way the law
So,
is right now, it does require the abortion clinic to make available this woman's right to know pamphlet. And it's about 128 pages. It's lengthy. It's not been updated in quite some time. They are in the process, I believe, of updating it, but certainly COVID has had an impact on the ability of everybody to do things like that. So um, this would somewhat take the place of that booklet with a much more personal avenue.
I guess in effect, what I was driving towards or trying to figure out and understand is that this provides an opportunity to choose an opportunity for life, not putting a woman who's pregnant in a position that she's not got options for choices, and she's just got the one option she went thinking about. So it's
Right.
a life bill in the sense that it protects all life.
Certainly.
Thank you.
Yes, ma'am. Representative Warren.
I'm just curious to know, is there any reporting data we will get to see if this program is being successful and what's going on? Because as I look at the fiscal notes, we're talking roughly what $3 million, and to say that we're putting $3 million out and not benefiting from what we're
Right.
doing, and at the same time we're saying that we can't give every child in the state of Alabama pre-K. I just want to make sure we're using money
Right.
wisely once we get them here to deal
So
with that.
let me make a couple of points. The fiscal note is actually based on the previous bill, not the substitute, which might change it just a little bit in terms of the timing, but really not the overall fiscal note. What's your question? What was your question? You asked a good question, and I'm trying to remember what it was now.
Is there any way that we
Oh,
can get
yes.
some
The
reporting?
bill actually
as
has
to-
specific reporting requirements that the vendor has to send back to Department of Public Health. And then it comes back to people. I actually tried to ask that it be sent to the chairman of the health committee, but I don't think that was for some reason allowed. LSA told me that, but it does come back to the Senate and the House, so we would have access to that.
I was just, just curious to know
Yeah.
that we are doing something that
Definitely.
benefiting somebody.
The other thing about the fiscal note is some of the fiscal note itself actually improves the entire IT structure at the Department of Public Health. So that would be another benefit to the department for working with this bill. That's really a one-time cost.
Any other comments? Okay, Representative Rafferty.
So I'm going to go back to the fiscal notes and that discussion there. So what would change substantively from the original bill to this one to bring down that cost? Hmm? 2.3.
There is an annual cost of about $10,000 for a toll-free phone number.
Okay.
Estimated 2.3 million to contract. That's actually the specific cost that is based on a per phone call. So if you
Understood.
multiply 7,000 pregnancy abortion-minded women times their rough cost is $325. That's where the 2.3 million comes in.
Understood. And the state would be paying for that, right? To pay for these services here.
Yes.
Okay.
The
So
rest of this is departmental type
understood.
things.
Gotcha. Well, I do know that I was able to get one of these the resources here. I was able actually to find Lifeline as well in Jefferson County. So, and I know that the clinics themselves have to pay for this to have
For the
have
piece,
these
for
printed.
the
Correct.
papers.
Okay. It's also
I don't know
kind
who
of
pays for them.
I think they pay for it. I think that's the law, and they have to give it within 48 hours or something along.
Right.
those
There's a
lines, right?
48-hour waiting period from
Right.
the time the woman
That's
comes in.
existing law.
Right.
Correct.
That's the existing law. And they are supposed to get that paper document.
And I'm all for giving women all the options. Absolutely. But if we look on the page of the substitute here and we look at what the organization, who can be one of these subcontracted or who can be one of these agencies, it's very restrictive, right? In fact, I'm concerned, there'd be nobody that would have had, any training and what, this legal and safe procedure could be like. There's no discussion of prevention for how to get women more autonomy and being able to have,
When you
more
say,
access to birth control and other things that they can have more autonomy over their
so
bodies.
when
and
you say
reproductive
prevention, are you
rights.
talking about prevention of pregnancy?
Yes. Yeah.
So the State Department actually has a really good maternal program that deals with prevention. And so this is, I mean, this is after the fact of this is the cart, the horse has left the barn.
Yeah.
There's not any prevention at that point. We have got to decide if we're going to have a baby, if we're going to abort a baby.
I understand. I'm just concerned about the kind of very restrictive list here of what the criteria for an organization that this woman could reach out
You
to.
talking about
would be.
Section 4?
I could be concerned about the information not being medically accurate, and not being medically pertinent, and that.
Are you talking about Section 4 or Section 5?
Let's
Where are
see
you?
here. I'm talking about Section 10. Each care agent providing services under this act and any individual providing program services through a subcontract or through an organization on a volunteer basis, which by volunteer, I guess they mean like people would come in and be able to speak and answer the phones, correct?
Right, and those
Right.
people have to be trained.
Right. But there's this, and who would be doing the training though?
I mean, that would be the vendor that's hired by the Department of Public Health, and the ADPH can put that into the RFP, or actually we've talked about doing an RFQ, which is a request for qualifications. So they would send out something saying, this is the need we have. If you're qualified, please apply. And that's probably less difficult than an RFP. But the vendor would have to follow what's in the RFQ, working through the department, with the department, and then they would manage the program. And that's somewhere back in there is also where it talks about the data that has to be sent back to the department,
Hmm.
which is why there's a need for an updated IT program, IT system.
Well, I mean, there's one good thing I like in here, and that's dealing with the completed training program regarding recognizing signs that an individual may have been a victim of human trafficking. I really
That's
do
a very
appreciate
positive part of
and
that.
like that part.
Should have mentioned that.
But I would say that the next part, it can't refer women to any other abortion provider or, just provide all the women with all the options. Like, so I'm okay with,
I mean, they've already got
providing
an
them
abortion
here.
provider. They've chosen. I mean, we don't want to offer them a conflicting provider. That would be somewhat problematic. In most places in Alabama, there's only one anyway. So,
Right.
I mean, we know that.
We do. All right. I don't have any more questions. I was just concerned about the medical accuracy of what information would be to be disseminated at these
I
call
mean,
centers.
did you see the 32-page book that they have online that has the pictures and all the development stages of a fetus from 0 weeks to 40 weeks? I mean, that's
Wait, I'm sorry.
you
Who's
haven't
that
seen
with?
that. It's on the department's website. I don't. I mean,
The
but
Department
that's
of Public
part of
Health?
what. Yeah, it's
Okay.
part of what the abortion clinics are supposed to give to the women.
All right.
It's a full color,
We'll look at that.
very well done document that shows the stages of the development of a baby from 0 weeks, which is not even pregnant. 2 weeks is when you start.
All right. I'll check that out. Appreciate your time and answering my question.
Thank you. Any other comments, questions? Well, I want to take just a moment as a parent of an adopted child some 28 years ago. Fortunately, the birth mother chose to go through the adoption process rather than the abortion clinic, and they actually started at the clinic and was referred to the adoption. I want to see it end up at the end. I'm just not sure our channel of getting there is the correct way. Save a Life, there are groups out there that I believe that how many abortion clinics we have? 5 in the state. I would think there's enough volunteers in this state that will set up camp next to those 5 abortion clinics, and then somehow through a mechanism that we require them to have a conversation with a trained person from Save a Life, that's their goal and mission every day in life to do, and to get them to them first. It saves the government out of it. It saves a phone call. I personally think that if you move them, and I forgot about the 48 hours, if they walk next door and see what the options are immediately then, and talk to someone that has a totally different view and gives them the options, whether the options is to call Medicaid, because that's the training part that needs to happen. They will let them know, okay, there's a way we can have this, you can have this child. There's financial help. There's all these things that we can have. That's when the state should get involved, in my opinion. But that's the type people that we ought to be sending these people to. Now, how we get there, I don't know, but I'm for what weight it's worth, that's my challenge to get this bill done to the end of the line. Will that happen this year? I don't know, but I think you'll have a much better bill that will have much better results. And then hopefully come June, July, we won't need this because there's going to be, there's going to be something happen at the Supreme Court. However, that's my comments on that. Any other comments before we close out this public hearing?
I do want to say that when Dobbs comes down, there's still going to be people who are getting pregnant in a crisis situation. So we're still going to need to be dealing with helping those moms,
No doubt.
keeping, getting the resources they need.
No doubt.
Hopefully, there will not be an abortion possibility.
All right. Thank you.
Thank you.
Okay.
If y'all will excuse me, I do have a Senate committee to get a bill to. Is that
Okay.
okay?
Appreciate you. Thank you. All right. The next bill on the calendar is HB 369 and Representative Lovern.
Thank you, Mr. Chairman, members of the committee. There are 3 states that do not have regulations, oversight for the medical imaging and radiation therapy. That's Alabama, Idaho, and Missouri. HB 369 would establish a radiologic imaging and radiation therapy advisory committee that would set guidelines and education requirements for conducting these x-rays and different types of radiology um, items that have been, and radiation itself has been identified as a carcinogen, and we all aware of that. And part of the process of working through this bill is trying to figure out which professions already have enough adequate training that we would not need additional training. And that is the process that we're in now. And I've worked with Chairman Lee, and he's been great as far as as we work through this process. We're not there yet with each uh, party of interest there, and we're continuing those discussions even today to try to make sure that we don't overstep with this legislation, but also try to find a way to protect patients that are receiving these services. And appreciate the time today for the public hearing, so you can air out and answer any questions that you may have. And I'm certainly available for any of those as well. So,
Okay.
Chairman.
Go ahead. I'm sorry. Representative Hall.
I think when I read this, I thought, are you serious that we've been getting radiation for different things and we are not sure that we're getting being appropriately uh, treated?
Well, there's certainly many professionals out there that do a wonderful job that are covering everything they need to do to protect the patient. But unfortunately, there may be other ones in there. And a lot of this reason for this bill is the unknown, because there's just not known exactly who is doing these, where it may just be an office assistant that goes back there. I've been to a clinic before where I even pushed the button to do a radiation. So it's, I think
I don't want to go to
sometimes
that office.
so I wouldn't recommend that one either. Uh, but it's there's just a lot of unknown. But there are some wonderful professional groups. Some of them you'll probably hear from today that are doing a great job. And this is not a bill to inhibit any of those people. But unfortunately, the unknown portion is a lot of the reasoning for this bill and for the discussion that we're having.
Thank you.
All right. Any other comments before we start the hearing? All right. We have 1, 2, 3, 4, 5, 6, 7, 8, 6 opposed, 3 support. We're going to try to keep it. We're going to keep it at 3 minutes. If you can finish it prior to 3 minutes, because that's about 21, 25 minutes before we can finish up. But we're going to scatter the support around in it so you won't hear all of one side the other. You will call those names, since you can read them and I can't.
Thank you, Mr. Chairman, for allowing me to speak today in regards to House Bill 369. My name is Eileen Meyer, and I'm an acute care nurse practitioner of about 25 years, practicing the majority of my time in cardiac surgery. And I'm also the senior policy advisor for the Nurse Practitioner Alliance of Alabama, representing approximately 6,000 nurse practitioners within the state. I think we can all agree that radiation safety is important, and I am not here to dispute that. I understand the original intent of this bill was to license and regulate radiation technologists and unlicensed personnel performing medical imaging. However, this bill has morphed into a double standard specifically affecting nurse practitioners by requiring us to register with a second regulatory agency in order to perform certain functions that have already been defined within our scope of practice by the Board of Nursing, who is our regulatory and licensing agency for nurse practitioners. Section 2 exempts all providers, such as physicians, podiatrists, chiropractors, dentists, dental hygienists, and dental assistants, who are already regulated under their respective boards. Section 2 also exempts students, such as medical students, residents, dental students, rad techs, students, and nuclear medicine students. And Section 2 also exempts all federal employees, including nurse practitioners that are employed by the federal government. Who is not exempt are nurse practitioners that are not employed by the federal government. Nurse practitioners are regulated by the Board of Nursing, and the use of radiologic imaging, including fluoroscopy, falls within our scope of practice. And you should have received a letter from the Board of Nursing confirming this. This bill would require nurse practitioners to register with a second regulatory agency that will establish a scope of practice for all persons licensed under this act, an act that exempts all licensed providers who are already regulated by their respective boards. This duplicity of oversight does not align with national regulations, and in fact, there are no other states that require nurse practitioners to register with a second regulatory board for a component of our practice. I'm also confused by this bill as it creates 3 different classifications for nurse practitioners: those who are authorized to perform radiology and advanced diagnostic imaging, meaning those who are grandfathered before December 31st of this year; those who are not authorized to perform radiographic imaging, and that includes all future nurse practitioners and all future graduates; and those who are exempt, such as nurse practitioners employed at a federal governmental agency. Healthcare is continuously evolving, and none of us can anticipate what the state of healthcare will look like in 10 years. But the passage of this bill will significantly impact nurse practitioners' ability to provide quality care and activities, which are considered routine in every area of our practice. Therefore, we oppose this bill as written and ask that House Bill 369 be amended to exempt nurse practitioners in Section 2, letter D, number 11. Thank you.
Mr. Chairman, members of the committee, my name is Michael Humber. I'm the state political director for the Alabama Association of Nurse Anesthetists. We, like the Nurse Practitioner Alliance of Alabama, we oppose this bill as written. As an advanced practice provider here in the state of Alabama, I've been practicing at UAB Hospital now for 22 years. Patient safety is key, right? As an anesthetist, every single day, if you go in for a surgical procedure, I will render you unconscious. I will keep you very safe while you're having your anesthetic done and having your procedure done. I will then wake you up, which is the most important part at the end, and take you to the recovery room. During that time, I'm all about patient safety. I'm your eyes and ears while you're asleep because you can't respond for yourself. So patient safety is not an issue here. We're all about patient safety. And I commend the radiology folks for wanting to try to make this about patient safety. Patient safety is important, but here again, like Eileen mentioned, one of the problems that we have is they're trying to regulate a group of people that is already regulated. So we're regulated by the Board of Nursing. We have administrative rules and regulations that say that we can provide radiologic imaging, that we can utilize fluoroscopy, for instance, in my practice. And that's a normal practice for nurse anesthetists across the state of Alabama. Now, I've worked with this organization over the course of this summer. They have made some changes to the substitute to the bill that you guys have before you, the substitute, in making some of the definition changes to radiography and so forth. But all throughout the bill, you hear about performance. And then when you get down to the last section, there's a grandfathering clause, which changes from performance to practice. In my mind, those are 2 different things. The practice of radiologic imaging is different than the performance. I understand trying to regulate and figure out who's pushing the button. And I think that's something that Dale has mentioned quite often, is who's pushing the button. So if you want to regulate who's pushing the button, let's get down to who's pushing the button, okay? There's other ways that we can regulate this and make the language so that it actually makes sense, okay? Right now, what this is saying is that me as a nurse anesthetist, it's leaving out there this obscurity of, am I pushing the button or is this me setting up the imaging equipment? So in our practice, what happens is an RT will come set up the equipment for us. We may step on the pedal to provide the radiologic imaging, but again, we're all about protecting the patient, providing shielding, appropriate shielding. We receive this education through our accrediting board. It's required through the Council on Accreditation of Nurse Anesthesia Educational Programs. And then we also have a National Board on Certification and Recertification that also requires this information as we go forward. So again, there's just a lot of work that needs to be done to make sure that this doesn't step over into our scope of practice as an advanced practice provider. I'm happy to answer any questions that you guys might have. One of the concerns that I really have is, again, we've asked to be exempted from this language. When you've got 10 different categories of people that have been exempted from this language, we're still not capturing every person that's pushing that button. Thank you.
Dale Smith.
Thank you, Mr. Chairman, for allowing me to speak this morning. My name is Dale Smith. I am the president-elect of the Alabama Society of Radiologic Technologists here in the state of Alabama. I represent 5,500 registered technologists here in the state of Alabama. House Bill 369 is presented to you today for the main intent of making sure that the patients in the state of Alabama receive radiographic medical imaging from qualified, competent individuals. We do not have any intent of stepping over into anybody's scope of practice. We do not in any way expect them to change anything that they are currently doing today unless they are operating X-ray equipment. They have not had the training to set mass, to set KVP, to set distance, to set up equipment for these radiologic procedures. That is our expertise. And that's the message that we're trying to get over in House Bill 369. Thank you.
Robin Lawson.
Thank you for allowing me the opportunity to speak with you today. Nurse practitioners, and I am a nurse practitioner. My name is Robin Lawson. I've been in practice for about 20 years now in the state of Alabama. Just to give you a little bit about what nurse practitioners are, is we must graduate from an accredited institution of higher education. We must hold a national board certification within our specialty area of practice. Then we can be licensed by the Alabama Board of Nursing. Once we're licensed, then we undergo a credentialing process within our employers. With that said, we must also practice within our scope of practice for our specialty. And that means ordering and interpreting diagnostic tests. So after that, we must also undergo continuing education so that we're kept abreast of current best practices with whatever it is our specialty is. Now, nurse practitioners are licensed, regulated, and sanctioned by the Board of Nursing, and we would like to keep it that way. There's really no reason why we should be regulated by an outside body. This legislation is not consistent with what's going on nationally and within other states in terms of nurse practitioner practice. So I do oppose this bill as it is written because of the nuances in there and the ambiguity too, and how it crosses over into our practice. So again, thank you for allowing me to speak.
Deborah Miller.
Good morning, Mr. Chairman, Mr. Vice Chairman, and members of the committee. My name is Deborah Miller, and I've represented, I'm sorry to say, not sorry, but you're part of it. I've represented the State Chiropractic Association for about over 25 years. I started to say 20, but I wanted to be truthful with my testimony. I'm here today to ask you to support an amendment that would exempt chiropractic assistants. As I said, I've worked with the association, the board for many, many years, and we have never received any complaint from a patient as it relates to a staff assisting a chiropractor. In the legislation as it's currently presented, a dental assistant is exempted, and a staff member who is assisting a physician is also exempted. Just to give you a little background, our polling suggests that about chiropractors do about 3 X-rays a day, primarily on the spine and on the neck. So there's not that many people in their office that are assisting. They don't hire someone to be an assistant. They just from time to time may assist in that procedure. I think the board should be commended. I know we talked about other states having restrictions and regulations, and we certainly want to protect the public. but we believe that there's just no evidence to suggest that a chiropractor, somebody in the chiropractor's office that assists them from time to time on a very limited basis should be required to have costly continuing education, and it's unnecessary. Thank you so much.
Buddy Goodwill, I believe. You can correct me if I'm wrong. Godwell? Okay.
Mr. Chairman, I appreciate it. Committee, I don't have anything typed down written. I wasn't expecting to speak today, but I appreciate you giving me the opportunity. And all the way and coming down there, I was thinking, what can I ask you guys, or what can I ask you folks to think about? And the biggest thing is what Representative Hall said a moment ago. She was I'm going to use the word appalled, if you would, Representative Hall, that you can walk in an office in this state and have a medical procedure done, a radiological procedure performed, and if you'll look to your right and to your left and in front of you and behind you in this state, that person can take your image. There's an assumption in the state, as Representative Hall made it very apparent, that all of you in this room at some point in time have had a procedure done. You've all had them. And you assumed that the person taking care of you was educated, was knowledgeable. Even in a chiropractic office, you would assume that the person has been educated and knowledgeable. I've been around for 34 years at a hospital. I started teaching in education about 10 years ago at Southern Union, where I teach students how to perform these procedures and try to spread them around the state. But unfortunately, they're not in all areas, as we've learned from our bill and from different areas and different people talking, CRNAs, nurse practitioners, and chiropractors. And I appreciate Mr. Lovren, when he started today, said that there are still some X's and O's and S's and plurals that we need to change a little bit. I don't deny that at all. If you noticed in the room today, and what really came to heart was the children that were in the room today. And all of you are mothers, fathers, you have grandchildren. They all get sick, they get hurt, and you're going to take them somewhere for imaging. And you sit there and hope that the person behind the door that you don't see is trained and knows exactly what they're doing with the technical factors used, which is the biggest thing that we talk about. And the other thing, and the other issue is, I think that it's the unknown for some for other people. The CRNAs I respect everything they do. I respect everything about nurse practitioners. I do. I truly, truly do. Much needed in what we do in the medical world. But knowledge of the equipment, how to use it effectively, they do not possess. I do. And I teach students how to. So I ask all of you, think about that as you look across the bill. I agree with Mr. Lovren. Let's work out some S's and dot some I's and get some things squared away. But in this state,
Time.
thank you.
Good morning. My name is Paul Harrelson. I am the president of Alabama Society of Physician Assistants, and I appreciate the time here and thank you for allowing me to speak. I agree that patient safety is at utmost concern for all providers of care, and radiation safety falls in that component. This bill would restrict physician assistant practice and affect PAs providing care in patients of Alabama. As you know, most of Alabama is underserved to access to care. Physician assistants in Alabama are licensed and regulated by the Board of Medical Examiners. PAs are trained in the medical model through their career in their educational career. As defined by the BME, the definition of a PA is a person who graduates from an approved program, is licensed by the Board of Medical Examiners, and is registered by the board to perform medical services under the supervision of a physician approved by the Board of Medical Examiners to supervise the assistant. So the oversight of PAs falls within the Board of Medical Examiners, and we shouldn't have to fall underneath another regulatory board. PAs have been performing diagnostic and interventional procedures that use radiation since the early 1960s. Most states' PA practice acts permit physicians to delegate the PAs the ability to order and perform diagnostic tests and the therapeutic procedures, including procedures that use ionizing radiation. PA education, training experience, delegated scope of practice of physicians, and the high quality of safe care they provide. PAs in Alabama should be included in the enumeration professions in Section 2 and not excluded in Section 5 as the legislation is proposed. It is incongruous not to provide an exemption for physician assistants, but to afford one for dental hygienists, dental assistants, and students enrolling in and attending radiographic programs. The students do not possess the educational credentials PAs and have applied in their everyday practice. Thank you very much for your time.
Celicia Valentine.
Good afternoon to the chairman. I do thank you for this opportunity to let me speak to you today. I am one of the representatives here that do oppose the bill. I am the vice president of provider services at American Family Care, and that hat includes supervising over 275 nurse practitioners and PAs. And when I read the bill as it is initially written, my heart sank because not only as an administrator, but as a practicing family nurse practitioner for 12 years, my scope of what I can do as I service patients is now being questioned. And not only did it sink about the capabilities, but it also sunk because I thought about all the we saw 2.2 million patients last year. And the way our organization is set up is you are probably going to see an advanced practice provider before you see a physician. And I thought about all the fractures that came in. I thought about the patients that had pneumothorax and broken ribs and things that we were able to quickly get x-rays ordered for and save and ultimately save their life and get them to their next destination. And so as I see this bill as it is, I do see it as a limitation to our profession. And I stand with the rest of my colleagues asking that we are considered to be a part of the exclusion as the rest that are listed on this bill. Thank you.
Okay, that concludes the public forum here. Representative Lovern, does anyone have any questions? Well, give me Representative Marcus.
Representative, you said that there was 47 states that's already doing this, that has this bill in place. Who are they exempting? I've heard a lot about the people who want to be exempted. Is it?
There's different variations from it, and we're taking some of that information of what's best practices, and like you heard today, some very accomplished organizations of professionals. And as we're working through this bill, we're not there, and we don't want to step on any of those toes. And so we'll take some things, some good practices from other states, and incorporate them. Well,
Representative Hall.
So maybe you've answered my question because I was trying to determine based on the information we've heard from the side that is opposing and what you have listed here, how were those different positions chosen versus the group that is saying that they've been excluded?
but well, I've learned that if you want to learn something about a topic, file a bill in that.
I'm sorry, make that statement again.
So we've learned a lot about this topic through working through this process, and I commend all parties involved that have sat down at the table and had discussions of how it affects their daily operations. How does it affect them taking care of the patients that are before them, and before this bill moves forward, I'll be able to look and say we've addressed those concerns for the best practices for the patient, because I think uniformly with the medical profession that when this bill is ready to move forward, it'll be where everyone's on the same page that what's happening in that environment is the best for that patient. And I'll be the first one to tell you we're not there yet, but we're
Good.
getting closer,
Okay.
and we just want to make sure we don't overstep on some of these great professionals, but also fulfill the goal of protecting that patient.
I still cannot imagine being in a setting where I would be getting an X-ray and the person that's doing the X-ray is not qualified for doing it. So, but thank you. I appreciate the work that that you're willing to do and to listen to the sides that have spoken. Thank you.
Any other questions, comments? All right, thank you, Representative Lovin. All right, I'd like to remind everyone, we have a meeting, Michael Ann, tomorrow at 9:30. 6:17. We will also be having a meeting next Wednesday for a public hearing for the optometry bill. And I would encourage anyone that speaks with you to encourage them. We will not be voting on it, but for them, those guys to get together and try to find some middle ground at some point, because I'm not sure that we as a body are qualified to know just how far someone should go when it comes to the eye. And it takes them working it out together to try to bring something to us. And you can put that down on record. Representative Hall, would you?
Please work it out.
All right. Everybody have a good day. Thanks.